You feel great. Somebody cares. Somebody's watching your back all the time. You know, you come in here and he sits down, he listens to you, what's wrong? You tell him,
66-year-old John Sarno is talking about the connection he has with his primary care physician, a connection that can lead to better health care. His physician, Dr. Stephen Atlas, is author of a new study published in Annals of Internal Medicine on the importance of connectedness between doctor and patient.
Connectedness refers to the closeness of a relationship between a patient and an individual physician. And typically, the sense that a patient will say, "This is my doctor," and that a physician will look at their lists of patients and say, "I know that person."
Researchers looked at more than 155,000 patients in a primary care network.
The importance of this study is that we showed that patients who are well connected to an individual physician have better quality of care than patients who are connected to either a practice or are not well connected to an individual physician.
Primary care physician Dr. Eric Wheel agrees.
One of the most valuable components of a good doctor-patient relationship is the relationship itself. The patient has to be comfortable that the person that they're coming in to see is a person that they trust, who's looking out for their best interest, who knows them, so that when there's a change in their care, when there's a change in their medical conditions, this is the person who will recognize it.
According to researchers, continuity of care is a shared responsibility between physicians and patients, but the growing shortage of primary care doctors can make getting connected a challenge.
There's lots of problems that are making patients and physicians less connected. One is there's just fewer primary care doctors out there. There are many patients who would love to come to see me and that I'd love to see, but my panel is full and all of my colleagues' panels are full. What do we do with those?
It just makes you feel good. No matter what you went in for, you come out, you feel a little better, And then that compassion is always there.
On behalf of the American College of Physicians, this is Jim Lawrence.